origin is the external occipital protuberance, so the skull. The medial portion of the superior nuchal line of the occiput. You have the ligamentum nuchae and the spinous process of C7 through T12. The insertion of the trapezius is the lateral 1/3 of the clavicle, the acromion, and the spine of the scapula. It's innervated by cranial nerve 11, or the spinal accessory nerve, and ventral ramus C2, C3, and C4. And the blood supply is the transverse cervical artery. Doesn't have blood supply. So next, levator scapula. The origin is the transverse process of 1st through 4th cervical vertebrae. The insertion is the medial border of the scapula between the superior angle and the superior portion of the spine. The nerve supply is the dorsal scapular nerve, or C4 and C5, and the cervical C3 and C4.
What's that?
And it's also the dorsal scapular artery. I don't have the blood supply in here, my bad.
Superficial.
So next is the latissimus dorsi. The origin is the inferior angle of the scapula. The spinous processes of the last 6 thoracic vertebrae, the last 3 or 4 ribs, and the thoracolumbar aponeurosis and posterior iliac crest. The insertion is the intertubercular groove of the humerus.
I'll do it on this side.
And the nerve supply is the thoracodorsal nerve, C6, C7, and C8. The blood supply is also the thoracodorsal artery.
Roberts.
So first is the rhomboids major. The origin is the spinous process of T2 to T5. The insertion is the medial border of the scapula between the spine of the scapula and the inferior angle. The nerve is the dorsal scapular nerve, C4 and C5. And the blood supply is also the dorsal scapular artery. Next is the rhomboids minor. The origin is the spinous process of C7 and T1. The insertion is the upper portion of the medial border of the scapula at the level of the spine of the scapula. The nerve supply is the dorsal scapular nerve, C4 and C5. And the blood supply is the dorsal scapular artery. Now we have the serratus posterior superior. The origin is the spinous process of C7 to T3. The insertion is the posterior surface of the 2nd through 5th ribs. The nerve supply is T1, T2, T3, and T4. So serratus posterior inferior. The origin is the spinous process of T12 to L3. The insertion is the posterior surface of the 9th through 12th ribs. And the nerve supply is T9, T10, T11, and T12. And we have the latissimus dorsi we did, right? The erector spinae group. So first, the most medial is the spinalis, and it originates from the spinous processes of the upper lumbar and lower thoracic vertebrae, the ligamentum nuchae, and the spinous process of C7. It inserts into the spinous process of the upper thoracic and the spinous processes of the cervicals except for C1. And the nerve supply is spinal. The longissimus is next. The origin is the common tendon. The transverse processes of the upper 5 thoracic vertebrae. The insertion is the lower 9 ribs and the transverse processes of thoracic vertebrae. The transverse processes of cervical vertebrae, and the mastoid process of temporal bone, thing near the ear. And the nerve is spinal. Next is the iliocostalis, and it originates from the common tendon, the posterior surface of ribs 1 through 12. It inserts into the transverse process of the lumbar vertebrae 1 to 3 and the posterior surface of ribs 6 through 12. It also originates in the posterior surface of ribs 1 through 6 and the transverse process C's of the lower cervicals. And it is innervated, the nerve supply is spinal. Serratus anterior.
Might be better on the other one. Actually, oh no, here we go.
Okay, it originates from the external surfaces of the upper 8 or 9 ribs, and it inserts into the anterior surface of the medial border of the scapula. Its nerve supply is the long thoracic nerve, C5, C6, C7, and C8. Teres major. It originates from the inferior angle and lower 1/3 of the lateral border of the scapula.
So it's this ring?
Yep, teres major.
It inserts into the lesser tubercle of the humerus. And the nerve supply is the lower subscapular nerve, C5, C6, and C7. Teres minor originates in the upper 2/3 of the lateral border of the scapula. It inserts into the greater tubercle of the humerus, and its nerve supply is the axillary nerve, C5 and C6.
Okay, so that's
Which
the
one did I went
teres.
for this one and then you pointed at that one.
That's okay. So that's the teres minor, and that's the teres
So then
major.
this is the, just so we know.
That is something else.
I don't think it's
Might be
attached to
better.
the
So
humerus,
does
maybe.
this, 'cause it's right above it, so it should be this.
Yeah.
Okay.
Okay.
Teres minor.
Super.
Spinatus.
Yeah. Let's.
That's
So
nice.
Supra is up
Oh,
there
yeah.
now. Yep.
The origin is the supraspinous fossa of the scapula. The insertion is the greater tubercle of the humerus. And the nerve supply is the suprascapular nerve, C4, C5, and C6. The infraspinatus originates in the infraspinatus fossa of the scapula, inserts into the greater tubercle of the humerus, and the nerve supply is the suprascapular, C4, C5, and C6.
Okay.
We did the subscapularis, right? Well,
No,
not-
we didn't do that yet.
We covered it though. The origin of the subscapularis is the subscapular fossa of the scapula.
This one's better.
It inserts into the lesser tubercle of the humerus. And its nerve supply is the upper and lower subscapular nerve, C5, C6, and C7. Any other ones?
Deltoid?
Didn't do it.
Well, that's
That's
Do you
more
have
shoulder
another one?
anyway. Yeah,
We did both.
yeah.
That's also the axillary nerve, right?
we did the posterior.
Posterior?
Are we
Yeah.
done?
Yeah.
Yeah.